Google and search for the system, or versus now you might have opened ChatGPT or Perplexity or Claude and asked that, hey, I have this specific pain, or and these are my symptoms. What do you think? What is it? Or can you recommend me some clinic, or any provider near my location? You might have done this, AI search instead of Google. That's all. That's what we're gonna talk today. That the search in, the shift in the search, and that's based on that. We also develop our platform, a tool, RankRabbit.ai, which helps patients to find right providers, uh, helping providers to be present in those answers. Let me go to my slide. So a little bit about me. Uh, I I've been working in tech from 12 plus years. Mostly around cloud engineering, data architecture, and now from last couple of years into agentic AI, what we call it. I have background of bachelor's in mechanical, masters in computer science, and worked in different sector, including fintech, and now running a startup from which has built this tool which helps find right patient, the right to right provider, connecting right patient to the right provider. Uh, so what what has the what is changed recently? This is a we call it Search 2.0, which uh, which is basically when we used to search you know earlier, that let's say, could you recommend me some doctor or a dentist, dentist. It used to give us 10 link. The Google used to give us 10 links. But now when you say something that I have pain in my teeth, you get is one answer. You get this, if you see on my screen, you get this AI overview. And it is based, the whole search is changing. So now it's based on a lot of stuff which we're going to talk in this presentation, that what it looks for, and why it's recommending to a specific one, versus there used to be 10 link, and then it was on your judgment to go on those and find the right uh, right thing which you were looking for, whether any specific information, or looking for any any provider as well. So this is what the search has changed. And let me go to the next slide. Uh, yeah, from search engine to the recommender system. So what actually changed under the hood is now the old model, which was the which was just a retrieval, based on keywords, or based on your whatever your query was. It used to pick up few words from the from your query, and it tried to match those keyword into the into the web pages, if any of the provider has. So but the new system, it doesn't it's not looking for those keywords. It synthesizes a lot of information, content, reviews, their authorities, based on your location and their location. And a lot of, our focus is more on the healthcare side. So whether they are certified, whether they are, board certified to, they have those right credentials. It looks for those, or those credentials, and then answer one answer to the, one answer, not leaving you with 10 blue links to figure out, hey, these are the links, go figure out. So people now, so since this is changed, people now trust a conversation more than just those list of those 10 blue links. So and in healthcare, in specific in healthcare, a wrong recommendation can harm a real person. It's like, so in let's say, if you would have asked questions like, uh, recommend me, or I'm looking for Italian food today, and if you get bad answer, or like not the wrong recommendation, or if it gives you some recommendation and which you don't like later, you're fine. It was just a bad dinner or bad food experience. But for healthcare side, it matters a lot. If you get a wrong recommendation, you totally get into different direction of your treatment you're looking for. uh, so, uh, so this is the the research paper, the things running under the hood, so the acronym is RAG, so retrieval, augmented, and generation. So that's if somebody wants to go into the deeper of this deeper into this paper and can look into it. But in nutshell, what it does is it retrieve those information and generate the retrieve the all the information available about the symptoms, and everything the query is looking for, and it generate one answer. The now look let's look at why the traditional way of searching is declining. Because the classical the search architecture used to be, when you query anything, so it search for those index keywords. It used to match those keywords with the web pages available, and based on those based on those ranked keywords, it used to generate output, and now you figure out. So the under the hood architecture mostly is vocabulary matching. There was a lot of flaw in this, that if what you are saying versus what content is published, what if those content is mismatched. But you want to bring in your expertise, and you have credential, but it's not represented right. And whatever and those the previously, whatever we have used those search engine, there was no context behind it. So there was a context blindness. The search engine didn't know what is our intent. And so the link dependency, there was no reasoning behind it. So whatever the synthesis is, it was depending on our own knowledge and link dependency. So user, but now this thing has changed, from lexical retrieval, basically getting query and matching with keywords, to semantic reasoning, so which is contextual based, based on intent. Now the one answer comes up. uh, yeah. So this is Google's query fan out system, which is running under the hood. So when you ask for a detailed query, what it does is, for example, this, if I'm searching, best solar panel for a residential home in Arizona. So if I'm searching this, it's not just running one query. Under the hood, it will run 10 different queries with 10 different subqueries, including like, which are, top rated residential, which is checking their authority, where if it's checking, resident, solar panel efficiency in high heat areas, or Arizona state specific sales tax credits, or, so it just, it's not just checking that, give me best solar panel for, for the specific zone. It will search for that area. It will search under, under the hood 10 different query, which are, relevant to those, and figuring out, what is, what is allowed in what, what specific configuration are supported in Arizona, if there are tax benefit on those areas, if there are, specific strength of those panel needed because of the strong heat in Arizona. So there will be a lot of different under the hood 10 queries, your one query divided into 10 different, or, multiple different subqueries, which you did not ask it directly, but the AI now, or the, this search knows that what's your, what you exactly looking for, and it tries and figure, based on those queries, conclude into one answer. So the modern search architecture, the how now AI native search system actually operate. So it basically, starts with first, understanding the query. So, LLM basically, infer your intent. If there is a ambiguity in your question, is try to figure out that, and the, and the context, latent objective, or, and then it query fan out. So it's basically, divides your query into 10 different, or I'm just keep on saying 10, but, with multiple different queries, subqueries, to get, get the information, and retrieve those information, those, embedding those, retrieval, embedding, retrieval those information, and create a knowledge graph, and synthesizes those, and the LLM synthesizes those information, and, give out one answer. So that's how the, query fan out actually work. It's, let's say if I'm searching for, best enterprise CRM for scaling SaaS companies. So it will not just search based on few reviews, or who has done more SEO work on those sites. Now it will look for different subqueries, like, which has better onboarding, better on, if, like, which is better on onboarding, if there are no complexity. It will look for, uh, you know uh, enterprise integrations, because enterprise is already using so many things. It will see that which has better integration capabilities, some retention metrics, some experience on Reddit, pricing comparisons, and the pricing comparisons, migration difficulty. So it will check all the under hood, those subqueries, and based on those, it will generate one answer. The retrieval, basically the, retrieval unit is shifting, and information chunk, instead of information, into chunk, it will just give a one answer to one questions. Um, so uh, the new front door to the care. So that's the, pictorial representation, that in traditional side, if you see on the left side, that's a old way of searching. You search, you get all your blue links, and then, and based on your judgment, you get it. But now with the AI strength, you are writing, doing a conversation, and you are getting a specific, based on your specific symptoms, your 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 issues and what you're looking for. It will give you a specific recommendation or a specific answer. So all the judgment, all the knowledge which you were not, didn't have or what to do, and just is, thinking that I don't know what should I do, but now it give you a exact right answer. So the core reframe, what used to be, and from being on page one used to be the goal. If any of the previous providers or any of the small businesses or small medium businesses, what their goal used to be when people search for those keywords, they wanted to come on Google's page one, and that was the all the goal. But now the shift is, now there is now there is no page one. Now it gives you a one answer. So you're you're either in it or you don't exist. So um, you know doing the traditional SEO doesn't make any sense, because people now, the search is changed, not on keywords anymore or matching keywords. It's now based on different factors, which I'll bring in and to the next slide. Now you are either coming into that one answer or you are not, don't exist. uh, so, um, so specific when I specific to the healthcare side where our focus is, the yeah, healthcare plays by different rules, because there are a lot of compliances need to play with. So there are common acronyms in the industry which now LLM needs to take care of. When recommending anybody is, these are two of the common one, which are YMYL, which is your money or your life. So this is one con the con what it actually means is content that could damage someone's health, safety, or finances, if given the if it gives the wrong information. So now the system would rather recommend nothing than recommend a provider if it can verify. So this in healthcare side, it's very critical. It's not looking for a restaurant recommendation or any of the tool information. In healthcare side, it matters a lot. It's your health, finances, and safety all are at the stake. So this is so the LLM need to take care of a lot of stuff, and the EEAT structure, which is the proof or more which is when LLM recommends or the AI search recommends, it has to look for uh, all these below four core concept, core element, which is their experience, their expertise, expertise, authority, and trust. That's EEAT structure or the algorithm behind it, which take care of giving right information, uh, rather than based on just one factor. It has to look for experience and expertise, authority, and trust. The factors AI weight on but it look for those credentials, those whether name or qualified authors are there on those, accuracy and accuracy and currency on those, first hand experience, where it will look for those reviews on the or testimonial on platform, and and the trust signal or consistency everywhere, whether let's say some information is different on one page and different on another page. That's not the trust signal. That's a weak sign that that there might this is not the right, or it's not strong. So so how patients actually now ask, in their care is, it's there are three different way a patient is asking, whether they are looking for recommendation, what is the best uh, endocrinologist near me, or or they can ask for, they are asking for condition or symptom based, like I'm getting dizzy, or uh, and I had this pill in the past, and I've or and what should I do? And or location based, I'm in this location, and I need a a pediatric or dentist open on Saturday. So specific use case, and but once but it will give one sentence for all the three pattern. It so based on those three, if you ask for one sentence and including all three patients, it gives you uh, you know will give you the right one answer. And so four layers of AI uses to decide who to recommend. So these are four layers which are embedded into our own tool as well. One is the search AI. Are you are you the answer, or in or just a result? The content layer, AEO, SEO, specific quotable statements get lifted straight into recommendation. If it can be quoted, it can be recommended. So now it's not just that you need to come into one place. You have to build your you have to build your strength on search AI, or the social AI, or reputation AI, or local listing. If any of the provider is just thinking that, okay, I have a page, that's it. No, you need the social AI as well, because AI looks for their social trust as well, whether people they have the right content on social, or they are active on social, and how people are talking about those that provider on social media. So or the the reputation AI, the reputation around let's say any of the platform, like review platforms, or the community platform, or the and the local listing AI, which basically uh, the foundation of uh, making sure that it's recommending right right provider in the local area. It focuses more on the listing of which are relevant to the local search, like Google Map, Google Map, Apple Map, or Yelp. So making sure that it's recommending the right local provider in that area. So the the content that earns recommendation. So the it now one thing any of the provider, or the a small business can do is, if if you are doing yourself, and making want to make sure that, okay, I start build some reputation in the eyes of AI search, or then just taking an example for the healthcare providers, they need to bring their content, or the in terms of explaining their conditions, or explaining uh, you know uh, like the answer, or the patient type, what are their symptoms, what are the diagnostics, what's the treatment, or giving a detail, building the detailed pages, or detailed information, that what to expect, what's a realistic outcome. And and the doctor's spotlight as well, their interest or approach to care, and notable cases, some testimonial. So if somebody wants to start out today, they should, focusing on making sure that they are, you know, checking all the boxes to make sure that AI recognizes and build, have trust. So for example, if a doctor is, having in their bio that, that Dr. Lee is an experienced dermatologist committed to quality patient care, and that's a very weak, comparing to now, as per the EAT signal, they should have that Dr. Lee is a board certified dermatologist with 16 year of specializing in, specific surgery, and she has performed 4,000 plus procedure, completed a surgical fellowship at and sees patient in English, Spanish, and French. So if you have, so this sentence covers EEAT signal comparing to the previous one, which is a weak bio. So with this, with EEAT signal, with this strong bio, uh, you are building slowly, getting better, building your reputation, and you might get cited into those answers. So this is the dashboard, or which of our own tool. The and in what we do is we help health providers to, help them bring into the search, into the right search, into the uh, connecting right patient to the right provider. That's what our tool does, and all the, local SMEs, they they are our patient, and they no they are our, customers. And what we provide is, at this moment, it's a invite only, our tool, the rankrabbit.ai, which helps, uh, which helps small medium businesses, or, focusing more on health provider, coming then into the right search. And our tool take care of their, search AI or social AI, listing AI, reputation AI, checking all their boxes and making sure that they are coming into those search and getting cited, comparing to what it used to be. So that's a new way of, managing, or managing your reputation, or making sure that they are getting into the answers which AI recommending, because whole search has changed. Um, Thank you. This was my presentation on, visibility in AI, and it's becoming, visibility in healthcare as well. Uh, yeah. Any questions? That was all from my end today.